5 p.m. I almost said Saturday. Wow. On a Monday evening, and we're back again with another local business in our community. This business, my son actually just got his braces off, and he is a patient at Meier and Benitez Orthodontics in Jupiter. And I'll tell you what, if you guys have never been there before, you walk in there, it's such a cool vibe. The staff's cool. The doctors are amazing. They got a game room that sometimes I wind up in there playing some video games, and they got some cool things to interact with and have fun. And these guys are like TikTok stars now. So if you have TikTok, I know they're all over TikTok. So I'm going to throw it right out now to Jeff Lichtenstein, who's the owner at Ecofine Properties, and Dr. Christian Benitez from Meier and Benitez Orthodontics in Jupiter. So Jeff, I'm going to let you take it away. And you got a little TikTok star in your hand there. So
my daughter is, and my daughter, got her braces there and had a great experience. And it was, you do a wonderful job. So tell us what's going on with how the world of orthodontics is adjusting to, COVID.
Well, what we had to do is take a brief pause, make sure that everyone's families were safe, all the patients were safe. We didn't want to see patients in the practice until we really got some direction from the CDC and from our local, actually our state dental board. What we've done when we came back is we've implemented some social distancing and some things that have changed in the waiting room. So we've implemented kind of like a digital waiting room where you can call ahead. We'll ask you to wait in your car. When we're ready for you, we'd actually text you to come in, send the patient in. If the patient doesn't need to come in with their parent, wonderful, come on back, we'll bring you back. We'll separate the chairs. We're not filling every single chair like we were before. And we're limiting those procedures to certain times of the day when there's not a lot of people around. So we're just trying to really minimize the patients that are coming through the office, just for the patient safety and ours as well, and our staff. Like Scott's been doing, or Dr. Meier's been doing for years, is everyone's a family member of Meier and what's now Meier and Benitez Orthodontics. So, I just want to make sure everyone's safe. And so we're wearing, our masks, our personal protective equipment like we've been wearing. But we've added some additional measures to keep our family safe. So things are back in. We're working still 5 days a week now, and 8 to 5. And we try to get everybody in that was delayed with their D-bonds, getting their braces off. We try to get everybody in so they could get their braces off finally. So we had, last week was almost like a D-bond week. Everyone was coming in getting their braces off. So we had a lot of happy kids coming through last week. So
how much, I never thought about that. So it's kind of like, long hair and facial hair and all this other stuff. So how much extra were people, like, was it like an extra month or so people had their braces on?
Yeah, month and a half, unfortunately for some. And, because we weren't able to really see any patients except for true emergencies. We had to push some of those patients back, and they came back with broken brackets, and unfortunately they didn't get their braces off right away, a couple of them. So we had to push those back another month or so, make sure everything's perfect. We're perfectionists. So, even the smallest thing that a patient might not notice, we notice, and we're definitely not taking them off until they're perfect. So they've been pushed back another month or so.
Are you doing some telehealth at all?
No, we haven't. We haven't really, but it's difficult to do in orthodontics and in dentistry as a whole, I think, because it's really hands-on. What we're doing is we're usually looking at radiographs. Patients obviously can take that at home, and the quality of the photos and the technology that we've implemented here at the office, it's difficult to replicate that at home and really get the best care for the patient. So Dr. Meier and I really decided that we were going to wait until this had passed to bring patients back, to give them the best outcome and the best care that we could provide, that we've been providing. So we really didn't. We've kind of been waiting until we could open up our doors.
Well, do you think there's going to be some changes that are going to take place at all on a long-term basis from this, or any other kind of technology that's being developed, because of this at all?
I don't think at this point, in terms of, at least for orthodontics, I don't think we're there yet. I think there's some digital scanners that are coming out into the market that may improve the efficiencies of practices. But other than that, I think maybe some personal protective equipment might change in the office as mandated by CDCs or state dental boards. other than that, the way that we practice, we've implemented every single new technology that's come out. We have, 2 scanners, everything that's come out, 3D x-rays, everything that's come out, we've implemented right away. So the only thing that may change is really going to be some personal protective equipment.
You have some older patients too, some that are not kids, more men and women who have had their teeth straightened out over the years, and are you treating them any differently, or are they more cautious?
We aren't. We do have older patients, and it's not that we don't care and we're not taking those steps to protect those patients. We're following universal precautions, and we're doing the best to keep every patient safe. So not specifically because they're 82. We have an 82-year-old patient that's coming in and wanted orthodontic treatment. So not just because she's 82 that we're going to go ahead and treat her any differently. We're going to do everything we can to keep every single patient safe in the office as they come through. So we're taking measures for everybody, really.
So, tell us a little bit about your background and why you partnered up, with Scott.
Really, it's an interesting story. So, I grew up down south in the Fort Lauderdale, Miami area, Pembroke Pines, and I went to Nova Southeastern for undergrad, played soccer for their men's soccer team down there. When I graduated, I took a year between my undergraduate degree and dental school, and my sister-in-law, who was 10, 11 at the time, was getting treatment by Dr. Meier. So I come to his office, I see that he had a posting for an assistant position open. So I walked in, I said, look, here's my resume. I'd love to have an opportunity. I had some experience, but limited. And he said, sure. Him and one of his staff members at the time who really helped me out, Gio, they took me under their wings. They taught me everything in terms of assisting, and I ended up getting into dental school with their recommendations and with their help. Went to Tufts. So I was at Tufts University for 4 years up in Boston. It was an incredible time to be there. They won a lot of championships. I don't know if you're a big sports fan, but
I'm dying for baseball. I'm a White Sox fan, probably the only one in the
Okay, Sox won while we were there. So it's a great sports town. I loved it. We had a great time. From there, we ended up in DC, did my residency, my orthodontic residency at Washington Hospital Center, and did a craniofacial at Children's National Medical Center in DC. And then ended up coming down. I opened up my own practice. Things didn't work out between Scott and I when we were first coming out. There was a lot of logistics. And then finally reached out to me and said, Christian, we've known each other for a long time. I obviously knew the practice from before, and, things worked out, and we're together now. It's a little different being on the opposite side of the chair and being the doctor in the practice, but it really has been amazing. It's been an amazing experience. The team is incredible. It's a family. It really is a family. And it's something that when I came back that I really wanted in any practice that I was going to be in, was to be in a family setting that Dr. Meier had set up when I was here years ago. And it's just the way that he treats people, treats his staff. It's a team approach. And you can see it when you walk in the door. Just like Rob was saying, it's a team approach. You feel like family when you come in. It's energetic. So we ended up merging together, and it's been perfect. We have a great time. We have lots of fun. Just happy to be here.
Yeah,
Go ahead.
Sorry, when you walk in there, the kids, orthodontics to me, or orthodontists, can be a scary thing. You're getting these metal things put on your teeth, and they're tightening them, and it hurts. But my son, I'll bring him in here in a little bit if he comes out here. He's got his braces off now. So he's wearing the retainer. I hope he's wearing it every night. Some nights I think he's skipping, so you may have to get on him for that. But, they make it this fun atmosphere. Just you guys, and this isn't a knock to you. You act like kids, but you have fun with what you're doing, and you get your point across to the kids in a fun way, in a fun manner. TikTok and all this stuff, but it's awesome. It's just so much fun. It's a family walking in there. That's what it feels like.
We really do. When you have fun at work, it's not really so much work, and we do all these things in TikTok and everything on social media and the gram. We're on all these platforms really to be part with the kids and to have a really good time, so that they're comfortable in the office, so they really get to know us and realize that we're not just the doctors that trying to, make them have a beautiful smile and happy for the rest of their life. It's really, to be part of the family, have fun, come in, you're in a safe, fun environment where the staff is amazing. And you're going to get a great result at the end of the day. And, it keeps us young at heart.
It's the right age to do it too, because when you're that age, it's kind of cool to have, everybody's doing it. I imagine it's harder when you're older, although there's less stigmatism, I think, today,
Right.
with my wife did it. I remember, as an adult, and it wasn't so bad, but there's more colors and more fun things to do. What are you guys doing with TikTok?
Well, we do any of these dance videos that are coming out, all these dance challenges. We've been doing some of those. We just play around with the office. You can get on there. You can see I think it's Meier _Benitez _ortho. That's our tag. But we're doing a lot of dancing, making fun of each other, having a good time, just keeping it light, keeping it fun. But we have a lot of adults that are coming through the practice actually, and we're trying to get them involved. We'll see if that ends up happening.
Besides the cosmetic part of it, are there any dangers for somebody not doing orthodontics that happen later in life if teeth get too? Can there be other medical problems that exist?
Well, definitely, there's definitely a functional component to orthodontics beyond the aesthetics that can be improved. And one of the things, and this is just a simple thing, but when you put teeth in the right position, they're easier to keep clean. Meaning that when you brush your teeth, it's easier to get in there and brush. It's easier to have access to the gums. There have been studies that have shown that gum disease can have effects and have some cardiovascular effects, and that's been tied and linked. So, if you have really bad gum disease, that can be linked to some cardiovascular issues. And so when we're able to put the teeth in the right spot and have them being a little bit more in an easier position to be cleaned, that sets you up for better periodontal health, which can then in turn, if you didn't have great oral hygiene in the first place, set you up for some pretty good cardiovascular health. Obviously, you need to take care of yourself in other aspects, and I think they need to consult their physicians with that. But definitely, there is some component to orthodontics that's beyond aesthetics. Definitely functional things too.
What's the difference? Can you explain between an orthodontist and a dentist?
Well, all orthodontists are dentists, but not all dentists are orthodontists, meaning that, we all go to dental school. All dentists go to dental school. All orthodontists go into dental school. Now, an orthodontist goes to a residency that's after the fact. So just like your physician goes to medical school, they may do an internal medical residency, like internal medicine residency. Your cardiologist goes to school after their medical school to become a cardiologist. Or an orthodontist is the same thing. So we go to 2 to 3 years of additional training just to move teeth and understand the mechanics and the biology behind moving teeth. So, we do have additional training. It's 2 to 3 years, depending on the program that you've gone to. In addition to that, we learn about surgical orthodontics, meaning that if some patients need jaw surgery, we're there to assist them. If somebody has a craniofacial syndrome that needs to be treated, we're also there, and we've done training in how to assist through that process with the craniofacial team, which usually includes an oral surgeon, plastics, speech pathologists, psychologists, or psychiatrists. So it's a team approach in that, but it's 2 to 3 years of additional training that your general dentist doesn't take. They may take a few, weekend courses, and some may take a little bit more, but it's 2 to 3 years of additional training. And so, if I've got a heart problem, I'm going to go to a cardiologist because I know they've done specialty training on conditions of the heart. So,
what and all the fields that you went to, and Tufts is a great university. What made you more interested in taking the extra step and going to be an orthodontist?
Oh, my aunt was a pediatric dentist, and so I had a little bit of exposure to that field beforehand. It was really when I was here with Dr. Meier. We just had a great time here treating patients. I love the results that we were getting. The patients were obviously happy. And it was just the type of work-life balance that I wanted, that I was looking for. And it was the type of treatment that I wanted to do for my patients. You have kids coming in that are at the age that have a lot of fun. They like to come into your office. They're not fearful. Most patients aren't, at least that are undergoing orthodontic treatment, aren't fearful of the orthodontist. And so I already had an idea when I was going through treatment. I mean, actually going through dental school, of what I wanted to do. When I was in dental school, going through all the different specialties, that's when it just confirmed it for me. I knew that that's what I wanted to do. I wanted to work with this age group. I know we see most of our patients, actually half our patients now are adult patients, but I wanted to work with kids. My wife is a pediatric dentist and she loves working with kids. It's just, it's a different age group. We have a lot of fun. And so I really just kind of knew before getting in that I really wanted to do that.
There's all sorts of good coffee flavors and stuff for for the adults too.
Right.
Yeah.
We have a full coffee bar now. I don't know with the COVID-19 protocol if we're gonna be able to get you some coffee. We'll figure out a way to get you a cup.
Hey Rob, any questions you have?
Yeah, one thing I like about Christian and Scott over there is that they give back to the community too. I swear you guys are at every soccer opening days with sponsoring. They have popcorn for the kids. They have little baggies they give out with a little thing. So they're active in the community with supporting local sports programs, which is amazing. And it just like I repeated before, that family atmosphere, and you walk in there, it's fun. It's not a scary time for a kid, because getting braces it's life changing. It's scary.
I didn't like getting it when I remember that, when I was that age, and like, what are you going to look like? And it was kind of a sterile environment with like just a kind of a serious doctor and stuff. So it's such a fun environment there. The kids my daughter wanted to have braces put on. It was like that type of a thing. She loved it there.
Yeah, I mean, we're committed to the community, and Dr. Meier has been he's been donating back to JTA and youth sports for the past 20 years, and we've committed ourselves to continue to donate to JTA and Palm Beach Gardens Youth Athletic Association for the next 10 years. Because we really believe in youth sports and what it can do for the growing child. I was obviously in youth sports. I played soccer all through high school. I played soccer in college, and I really think it really helps you develop and helps kids develop. And we want to allow other kids to have that opportunity. And so we've had that commitment for the next 10 years to youth sports. So
you have a 2-year-old?
I have a 2-year-old. Yeah.
Any Pele feet yet?
I wish. I keep trying to get him to kick a ball, but he keeps picking it up. So I think I ended up buying a baseball bat. So we'll see how that goes. I might have to ask a few friends to help me out with that. Baseball's not my thing. But.
What's the mascot's name again? The Shark? Is it named to the mascot?
Sammy?
Is it Sammy? Sammy the Shark?
Yeah.
And Sammy, I saw a video not too long ago. I think it might have been a TikTok video or something. My kid showed me this Sammy the Shark dancing around. Who is it? Is it you or is it Dr. Meier in the suit? Who is it?
Depends on the video. I got to tell you, I love getting in that suit and have a good time. So it may be me. It could have been Amy. It could have been Scott's sister. It's probably usually one of us two that are in there. But if it's one jumping around, it's probably me. I love getting into it. Just have a lot of fun with it, have a lot of fun.
And there's my, so show them your teeth, smile. Oh, you got to get in more.
No, you can't see it.
Oh,
that is a good smile.
You see that? See how bright that was? Oh, wow. Set the bright smile. Looking good. Make sure you're wearing your retainer.
Go ahead.
Yeah, exactly. Wear it every night.
Yeah, I do. Okay,
good.
I was awful with the retainer.
It happens. I mean, we have a lot of adults and patients in treatment now because of it. A lot of.
Do they have color retainers now? Are they fun things or no?
Yeah, we have color retainers with the bar, and they can make different shapes and fruits. It could be watermelons. It could be the different sports. As long as it's not a Gators, then we allow it. So and Michigan. Well, I don't like the Gators, and Scott's not gonna like any Wolverine colors going around here. So
that's funny. That's funny.
Definitely nothing with that Philadelphia area with the Eagles or that stuff. You don't want
Ah.
And
Look, I'm a big Cowboys fan, so it's definitely not going to be an Eagles.
Oh, we got to end this conversation. What, Jeff? I did not know he was a Cowboys fan. We can't even continue with this conversation. Oh boy,
America's team, man. Come on.
Eagles, baby.
America's team.
But I want to thank you, Christian, for coming on today, and give Scott our best. I know he's busy, but again, Jeff, another local business in our community that gives back. I mean, they give back big time too. They give back big time to local sports and to.
These guys are the best orthodontists in the business, and they're part of the community, and that's where you should, absolutely check them out. They're professional. They're safe to go to, and they know what they're doing, and it's a great experience. Most important for your kids, because if they come in loose and they're not afraid to go to the orthodontist, then it loosens them up and makes that whole 2, 3, whatever that your experience is, much easier.
Yeah.
So parents, if you're watching and you're looking for an orthodontist for your child, these are the guys to go to. The number's above the poster. You can give them a call. Their website's also there, so you can check them out. Anything else, Christian, you want to say?
I want to thank you guys, and thank you guys for inviting us on. I know Scott couldn't make it to it. We're still, he's actually still finishing up some patients, trying to get everybody caught up from the time that we're off. But I really appreciate it. Thank you guys I appreciate the highlight. We do our best for every patient. So I want to thank you guys. Thank you very much.
Thanks for coming on. And Jeff, I think that wraps it up for the day. That was four
different ones. Yeah.
4 different businesses. And then tomorrow we have 4 more businesses. So I want to say thank you, Christian, from Meier and Benitez Orthodontics, and Jeff, as always.
It's my pleasure. Thank you so much.
We'll see you guys tomorrow.
So long, everybody.
Bye.
Bye.